Vitamin B12, why your levels matter in 2026. Today we are talking about vitamin B12 and why it is important to know your level, especially in 2026. B12 is essential for the health of nerves, your brain, and your blood. If it becomes low and is not detected early, it can lead to permanent nerve damage, memory problems, balance issues, and a type of anemia. This talk is based on a very large scientific study published in the Journal of Frontiers in Nutrition in 2026, which analyzed millions of blood tests and showed that B12 deficiency is still very common worldwide. The good news is that B12 deficiency is easy to detect with a simple blood test, and in most cases, it is also easy to treat if caught early. This presentation is for education only. To help you understand why checking and maintaining healthy B12 levels is an important part of preventive health and why any testing or treatment should always be discussed with your doctor. Compiled by Dr. Siva Navaratnam and ChatGPT, my educational partner. Vitamin B12 is one of the most important vitamins for the nervous system and the blood. It also helps keep the brain and nerves working properly. When B12 is low, people can develop numbness, tingling, balance problems, memory issues, and even permanent nerve damage if it is not corrected early. B12 is also essential for making healthy red blood cells. When levels are known, a person may develop anemia, leading to tiredness, breathlessness, and weakness. At a deeper level, B12 is needed for DNA synthesis. This means it is involved in cell repair and renewal throughout the body. Because of these roles, B12 affects both mental energy and physical energy. This is why people with low B12 often feel exhausted, foggy, or low in mood. The key message is that vitamin B12 is not just another vitamin. It is essential for brain health, nerve health, and healthy blood, and low levels should never be ignored. This slide summarizes findings from a very large population study that analyzes more than 84 million vitamin B12 blood tests. Over a period of 7 years, doctors ordered B12 tests much more often, about 12 times more than before. This shows that awareness of B12 deficiency is increasing. However, even with more testing, low B12 levels are still very common in the population. The study also found that hospital admissions associated with low B12 increased by about 32%. This does not mean B12 directly caused all these admissions, but it shows that low B12 is frequently seen in people with serious medical problems, especially involving the nervous system, blood, heart, and mental health. Another observation was that women were tested more often than men, and abnormal results were also common in women. The key message for the public is that B12 deficiency is common, important, and often overlooked, and that early testing and treatment can help prevent serious and sometimes permanent nerve and blood problems. Certain groups of people are more likely to have low vitamin B12. As we grow older, our stomach produces less acid, which is needed to absorb B12 from food. This means deficiency becomes more common with age. Vegetarians, and especially vegans, are at risk because vitamin B12 is found mainly in animal foods such as meat, fish, eggs, and dairy. Without fortified foods or supplements, levels can gradually fall. People taking medications like metformin for diabetes or acid reducing medications for reflux may absorb less B12 over time. This is a well known effect and is one reason doctors often monitor B12 in these patients. Finally, people with stomach or bowel problems such as celiac disease, inflammatory bowel disease, or those who have had gastric or intestinal surgery may not absorb B12 properly. The key message is if you belong to one of these groups, it is sensible to discuss B12 testing with your doctor even if you feel well. In this large study, researchers also noticed that when vitamin B12 was low, other B vitamins such as B1 and B6 were often low as well. This suggests that the problem is sometimes not just one vitamin, but a broader issue with nutrition or with absorption from the gut. B vitamins work as a team in the body, especially in nerve function, brain health, and energy production. If one is low, others may also be low. For this reason, when a doctor finds low B12, they may sometimes check a full B vitamin panel to make sure there are no additional deficiencies and to guide proper treatment. The key message is that B12 deficiency can be part of a bigger picture and it's important to look at overall nutritional health, not just one number. For people who eat animal foods, vitamin B12 is naturally found in meat, fish, eggs, and dairy products. Red meat such as beef, lamb, goat, as well as fish and shellfish are particularly rich sources. Eggs and dairy also provide useful amounts. Including some of these foods regularly, even in small portions, can help maintain healthy B12 levels in people who can absorb B12 normally. However, it is important to remember that some people may eat enough B12 but still have low levels because of absorption problems, such as low stomach acid, gut disease, or certain medications. In these cases, food alone may not be enough, and supplements or injections may be needed under medical advice. So, diet is the first step, but blood testing and medical guidance are important if deficiency is suspected. Sometimes diet alone is not enough to correct low vitamin B12. Supplements are usually recommended when blood levels are low or borderline, or when the body cannot absorb B12 properly from food. This can happen with increasing age, stomach or bowel conditions, after gastric surgery, or with certain medications such as metformin or acid-reducing drugs. For many people, an oral tablet of 500 to 1000 micrograms per day is commonly prescribed and is safe when taken under medical advice. In severe cases or when absorption is poor, doctors may recommend B12 injections for a period of time to quickly restore blood levels and protect the nerves and blood. The important message is supplementation should be guided by blood tests and a doctor's advice, not by guesswork or advertising. There is a lot of advertising today promoting very high or mega doses of B12 supplements, sometimes suggesting that more is always better for energy, memory, or aging. From a medical point of view, this is not correct. Once your B12 level is in the normal range, taking much higher doses does not give extra benefit to the brain or nerves. While B12 is generally safe, unnecessary megadosing can lead to false reassurance, wasted money, and may also mask other important medical problems that need proper diagnosis. The sensible approach is, first, check your B12 level with a blood test. Second, correct any deficiency with the right dose. And third, continue only what is necessary under medical guidance. So the message is, do not be guided by advertising. Be guided by evidence, blood tests, and your doctor's advice. To summarize the whole talk in 3 simple points. First, vitamin B12 is essential. It is vital for healthy nerves, a healthy brain, and healthy red blood cells. Second, B12 deficiency is common, especially in older adults, vegetarians, people with gut problems, and those on certain medications. The good news is that it is usually easy to detect and treat if found early. Third, the correct approach is test your levels, treat properly if it is low, then maintain it at a healthy level. Do not guess and do not rely on high dose advertising. Work with your doctor, use blood tests, and correct only what is needed. This simple approach can prevent serious and sometimes permanent nerve and blood problems. Thank you for watching.